Today we're going to talk about how to pay for plastic surgery, financing.
How do you pay for, if you don't want to save up all that cash, how do you pay for it?
I mean, I understand that it's a difficult topic for a lot of people. They come in, it can be a lot of money. People come in with these great expectations and they want to look beautiful, and then they see how much it costs.
And they deserve it. And then
right.
the price kicks in.
And then the price kicks in. So what, especially in this day and age, a lot of people don't have, you know, thousands of dollars in cash lying around. And so the solution is patient financing. And there are several organizations out there who will look at your credit score and look
just
at
like
your,
applying for a car or a credit card.
And they're actually a little bit more lenient than most credit cards.
Oh,
and and they pay the doctor. The biggest one, the most common one, is care credit.
Care credit, right.
Which people use for the dentist or the vet.
Right, everybody,
A lot of people already have a care credit card. Yeah. And there are other ones out there, My Medical Loans, surgery.com, I think. All of these are on my website. There's a financing section. It's www.danielronelmd.com, and that's where you can find out about financing.
And wait, here's one thing. Here's the shame factor. You know, we've all been there. We all get it. It's for everybody.
It actually is for everybody.
I mean, even rich people who might have the thousands of dollars sitting around, they are uncomfortable parting with it right now because they don't know what's going to happen. So they'd rather take out a little loan, deal with that, instead of sticking their cash out. So,
and in fact, there are loans, programs, 18 months, no interest. And I mean, anybody would like that. I end up paying the interest.
You listening, governments? We need that for houses and such. Okay.
You know, I end up paying the interest, and so, yeah, that's just very convenient for people if you pay back in 18 months or whatever the terms are.
It's excellent. It's like a furniture store.
Exactly.
18 months, no interest.
Right, so you have a monthly payment that you know is going to happen, and that's a very convenient way to do it.
Yeah, I mean, I'm someone, I lease my cars. I don't buy my cars. I'm not going to lay out whatever it is in cash. I don't want to.
Yeah.
Another
option that people like to do is they combine. They pay some in cash and some they finance, because they often come to the table with some cash, so they don't have to pay as much in interest or whatever the monthly fees are.
Right. I love it. I love it. I love it. I love that idea of the payment plans and such with the credit companies.
Another thing that patients can do is they can look for 4 times a year. We do a Vanity for Charity month.
Yes, we do.
Where all of our profits from injectables or Botox are given to a different local charity. This summer, we're doing the Adoption Means Love Foundation.
Right.
And
that's in June this month.
Right, and the reason that I mentioned it on this show is that I discount the injectables by 20% to get people in the door so that I can send the profits out.
Right.
And so, you know, our e-blast, our newsletters on our emailing list, and we advertise. Those are things to look for, because you can say 20% of a couple $1,000s.
You know what we should do?
Significant.
We should make them every single year the same exact month, so people can time that. I think that's a good idea. Okay. Make a note.
Okay.
Okay.
You're listening to Talk 1260 KTRC. This is Dr. Daniel Ronel. I'm a board-certified plastic surgeon on Western Medicine, a show about plastic surgery. I'm here with my wife, Betsy Ronel. Thank you very much for listening. We'll be back in a few minutes.
That's the end of our show. Thank you so much for listening. You are listening to Western Medicine on Talk 1260 KTRC. And we'd really love to hear from you. Any questions, comments, storyline ideas, whatever. Send it our way at our website, www.danielronelmd.com. And in fact, what we're going to do is start compiling listener segments where we read your questions on the air and then answer them, as well as put your storylines on the air. So we're really looking forward to hearing from you. And that's it, Santa Fe. Thank you so much. We'll talk to you next week.